Okay, good day nurses. So we will now move on to the part 2 of your respiratory system, which is the diagnostic procedures. Okay, so let's discuss this sputum specimen. Okay, this sputum collection. Okay, this specimen here guys is obtained by either expectoration or tracheal suctioning. O when we say expectoration, expectorate yung patient ng sputum. Okay, then ilalagay sa tube, then yung tube ipapasa doon sa lab, okay? Then similar to tracheal suctioning, but this time you will use a suction machine naman, okay, para makakuha ng sputum. Then ilalagay mo rin yung sputum doon sa tube, then ipapasa mo siya doon sa lab for reading, okay? This is to assist in identification of organisms or abnormal cells, okay? For example, sa pulmonary tuberculosis, okay? Para ma-identify kung present ba yung organism na meron sa tuberculosis. So, dito natin ginagawa yung sputum specimen collection. Okay, nagagets? Para ma-identify kung meron ba talaga yung organism na meron kay tuberculosis. Okay? So, what is the pre-procedure of this one? Okay? First is to determine the specific purpose of collection o such as kung i-identify or i-diagnose yung patient for pulmonary tuberculosis, and we need to check institutional policy for appropriate method for collection. Okay? Sa collection ng sputum guys, kailangan early in the morning. Okay? Kailangan early in the morning. Okay? Either expectoration by expectoration or suctioning. Okay? Then, you instruct the client to rinse the mouth with water before collection. Be careful with this one guys ha. Kailangan water lang, okay? Kasi kapag may iba kang ginamit guys, sa pag-rinse, pwedeng ma-alter niya yung result, okay? Then you obtain 15 ml of sputum. Okay? So, instruct the client to take several deep breaths and then cough deeply to obtain sputum. Then, ilalagay niya yun sa tube. Okay? Then, always collect the specimen before the client begins antibiotic therapy. This is common sense, guys. Of course, we all know antibiotic therapy is antibacterial. So, pinapatay niya yung bacteria. Tama po ba? Yes. So, kapag nag-administer ka ng antibiotic na muna bago ka mag-sputum collection, pinatay mo na yung bacteria bago ka pa mag-collect. Then, therefore, ma-alter yung result. Tama ba? Yes. Okay? So, the first procedure for this one naman, guys, if a culture of sputum is prescribed, you transport the specimen to the laboratory immediately. Then, you assess the client with mouth care. Okay? So, this is the step-by-step on how to collect sputum guys. Okay, so kailangan mo ng collection tube, plastic bag, and a paper bag. Okay, so early in the morning, you instruct the client to take 3 deep breaths, then mag-ubo siya, then labas siya ng phlegm, then yung phlegm or the sputum, ilagay niya dun sa tube. Okay, then you instruct na wag niyang ilagay yung mouth niya dun sa tube, okay, because it can alter the result. Okay, then you label the tube with the name and date of the patient, then put tube in a plastic bag, then ilagay mo sa paper bag, then you put the paper bag in the refrigerator, okay? Then you collect 1 tube a day for 3 days, okay? Next is the laryngoscopy and the bronchoscopy. When we say iscopy guys, we are visualizing something, okay? Saan daw tayo nag-visualize? Doon sa larynx and sa bronchi ni patient, okay? Dito sa laryngoscopy guys, we are inserting a scope doon sa nose ni patient until ma-reach niya yung larynx, okay? Si bronchoscopy guys, we are inserting a scope papunta doon sa bronchi ni patient, okay? So, sa mouth ini-insert until ma-reach niya si bronchi, okay? Yun yung difference nila guys. Kay laryngoscopy, sa mouth ini-insert, si bronchoscopy, sa mouth ini-insert. Nagkamali ako. Si laryngoscopy, sa nose ini-insert. Si bronchoscopy, sa mouth ini-insert. Okay, wag kayong malito dun guys ha. Si laryngoscopy, sa nose. Si bronchoscopy, sa mouth. Okay? So, we are inserting a tube. So, definitely guys, kailangan nating mag-administer ng sedatives. Okay? So, the pre-procedure for this one is to maintain NP or nating by mouth status as prescribed. Bakit guys? Since we are administering sedatives, okay, to prevent aspiration to happen. Okay? Then, we assess the results of coagulation studies, okay, such as the PT and the APTT, okay? Para ma-assess natin yung patient kung at risk ba siya for bleeding during the procedure, okay? Then, remove dentures and eyeglasses. The same lang guys to prevent aspiration, okay? Then establish an IV access as necessary and administer medication for sedation as prescribed. O kailangan may IV access, okay, pre-procedure guys, para during the procedure, kung magkaroon man ng complication guys, doon na lang sila mag-administer ng medication para direct na siya guys and mabilis yung absorption. Okay? Then lastly, have emergency resuscitation equipment readily available. O kailangan nandyan na yung pang-intubate and also yung bag valve mask, mga ganyan, para in case guys na magkaroon ng obstruction dun sa airway or complication guys, available na siya kaagad, mabilis na lang ma-i-intervene yung patient. Okay? Then the post-procedure for this one guys, we need to maintain the client in a semi-Fowler's position for lung re-expansion naman to guys. Okay? Then we assess for return of gag reflex. Since nag-administer tayo ng sedatives, tama, kailangan guys NPO muna yung patient natin until the gag reflex returns, okay, to prevent aspiration to happen. Okay? Then we monitor for bloody sputum. Okay? Then, you monitor the respiratory status, of course, particularly if sedation has been administered. O, what's the normal respiratory status? Kailangan 12 to 20. Okay? Then, you monitor for complications such as bronchospasm, nagkaroon ng narrowing, bronchial perforation, nabasag yung bronchi ng patient, indicated by facial or neck crepitus. Ano pa? Dysrhythmias, hemorrhage, o, kapag may active bleeding, hypoxemia. What's the normal ba? Kailangan 95 to 100%. And lastly, pneumothorax. Okay? Then, you notify the healthcare providers guys kapag may nangyari sa mga to. Okay? You notify the healthcare providers kapag may nangyari sa mga iyan. Okay, and that is all guys for your laryngoscopy and bronchoscopy. So, ito siya guys. Your laryngoscopy, mag-insert ng tube or i-insert yung scope papunta dun sa larynx for direct visualization. Then, this is the bronchoscopy naman. Mag-insert ng tube doon sa mouth naman papunta sa until ma-reach niya si bronchi. Okay, for direct visualization also. Okay? Then, we move on to the thoracentesis. Okay? This procedure naman guys, it is a removal of fluid or air from the pleural space via transthoracic aspiration. Ang ginagawa dito guys, we are inserting a needle. Okay? A needle. Then, i-aspirate natin yan. Then, madedrain na ngayon yung fluid. Okay? Either air or fluid guys. Okay? Air guys kapag pneumothorax yung case ng patient. Then, blood naman kay hemothorax. Okay, nagigets? So, what's the pre-procedure for this one, guys? Okay, you need to prepare the client for ultrasound or chest radiograph if prescribed before the procedure. Okay? Then, you assess results of coagulation studies para ma-assess mo kung at risk ba for bleeding yung patient natin. Then, note that the client is positioned sitting upright with the arms and shoulders supported by a table at the bedside during pre-procedure. So, ganito yung position ng patient natin. Or, if the client cannot sit up, the client is placed lying in bed toward the unaffected side with the head of the bed elevated. So, pag ganito. So, toward the unaffected side. Bakit guys? Di ba meron tayong dalawang lungs. So, either right or left lung. Okay, nagigets? Then, instruct the client not to cough, breathe deeply, or move during the procedure. O bakit guys? Kasi nga, during the procedure, mag-i-insert ng needle, tama po ba? So kapag nag-cough or nag-move yung patient natin guys, possible mag-move din yung lungs, tama? So possible guys na ang matusok mo yung lungs ni patient. So delikado pag nangyari yun guys, okay? Then the first procedure for this one, you need to monitor the respiratory status. Okay? Then apply a pressure dressing and assess the puncture site for bleeding and crepitus. Then lastly, you monitors for signs of pneumothorax, air embolism, and pulmonary edema. When we say pneumothorax, guys, merong na-trap na air doon sa lungs ni patient. Okay? Then pulmonary edema, nagkaroon ng tubig doon sa lungs ni patient. Okay? And that is all, guys, for your thoracentesis. Okay? Then, we move on to the pulmonary function test. Okay? It is a test naman used to evaluate lung mechanics, gas exchange, and acid-base disturbance through spirometric measurements, lung volume, and ABG or the arterial blood gas levels. Okay? So, pre-procedure for this one, guys, you determine whether an analgesic that may depress the respiratory function is being administered. Of course, guys, kapag administer analgesic, meron kasi mga analgesic medication na nakakapag-depress ng respiratory function. So, ma-alter niya ngayon yung result, guys. Siyempre, bababa yung mga makukuha mong result. So, kailangan i-determine mo muna yan, okay? Then, you consult with the healthcare provider regarding withholding bronchodilators before testing. O kailangan guys, i-withhold mo ang bronchodilator. Syempre, bronchodilators yan. Kapag na-dilate ang bronchi or the airway ng patient natin guys, syempre, maganda yung flow, tama? So, ma-alter niya ngayon yung result. Okay, so kailangan naka-withhold muna ang mga bronchodilators. Okay? Then, instruct the client to void before the procedure and to wear loose clothing. Then, remove dentures. Then, lastly, we instruct the client to refrain from smoking or eating a heavy meal for 4 to 6 hours before the test. Okay? Then, post-procedure guys, the client may resume a normal diet and any bronchodilators and respiratory treatments that were withheld before the procedure. So, after, pwede nang i-resume yung mga yun guys. So, let's discuss the spirometric measurements guys. Okay, the incentive spirometric measurement. Okay, so ganito ginagawa yun guys. Okay, sa incentive spirometry, so ganito ang itsura niya guys. Okay, ganyan ang itsura niya. Okay, so client instruction for incentive spirometry. Okay, you instruct the client to assume a sitting or upright position. So kailangan naka-sitting or upright position si patient yan during the incentive spirometer. Then, instruct the client to place the mouth tightly around the mouthpiece of the device. So, may mouthpiece kasi yan. So, kailangan tightly siya around the mouth of the patient. Then, instruct the client to inhale slowly to raise and maintain the flow rate indicator between 600 and 900 marks. So, makikita mo naman dito yan, guys. Okay? Then, instruct the client to hold breath for 5 seconds and then to exhale through pursed lips. Then, instruct the client to repeat this process 10 times every hour while awake. Okay? So, ginagawa tong incentive spirometry, guys, to prevent lung collapse or lung atelectasis na sinasabi, guys. Okay? So, ang ina-assess dito, guys, is during the inhalation. Okay? Yun yung kailangan mong tandaan dito, guys. During the inhalation. Okay? So, we now move on to the chest X-ray film or radiograph. Okay, alam nyo naman na siguro ang X-ray guys, di ba? To visualize the anatomical location and appearance of the lungs, of course, di ba? O ganyan yan guys. Then, pre-procedure for this one is to remove all jewelry and other metal objects from the chest area. O bakit kaya guys? Kasi yung mga jewelry or mga metal objects guys, pwedeng, kunyari, nakasuot yan kay patient guys, makikita mo siya ngayon dito sa X-ray. So, pagdududahan ngayon nung doktor na magre-read ng X-ray guys kung ano yun. Baka mamaya sabihin niya tumor yun. Okay? So kailangan walang jewelry and metal objects from the chest area. Then you assess the client's ability to inhale and hold his or breath. Kasi i-instruct later on si patient nung rad tech na i-hold niya yung breath niya during the X-ray na guys. Okay? Then the post-procedure help the client to get dressed. Okay? So, ganun lang naman ginagawa, guys. Actually, RadTech ang gumagawa naman nito during the procedure naman na. Diba? Pero, alam nyo naman na siguro yan X-ray naman na siguro kayo, diba? Okay, now we move on to the last procedure of your respiratory system. Okay, so we have the CCT or the chest tube thoracotomy na tinatawag. Okay, your CCT, guys, or that chest tube, guys, ang ginagawa niyan, tinitreat niya yung lung collapse ni patient or the atelectasis na tinatawag. Okay? Paano? By draining air or yung tinatawag nating pneumothorax or by draining blood, that is your hemothorax naman, or other fluids from the pleural cavity. Okay? So, it allows the lung to re-expand. Okay? So, meron siyang two types, guys. We have the dry and wet suction na tinatawag. So, okay? This is the wet suction and this is the dry suction. Okay? The dry suction, guys, the suction is controlled by a suction dial. Okay? Ito yung dial na sinasabi, guys. Okay? Si wet suction naman, guys, the suction is controlled by a water. Okay? By a water. So, depende kung gaano kadami or kakonti yung water na nandun sa water suction chamber. Okay? Ito siya guys, kung madami ang water na nandito sa suction chamber guys, then therefore malakas din yung pag-suction, okay? Pag konti lang siya guys, then therefore mahina din yung pag-suction, yun yung wet suction, okay? Oh, the dry is controlled by a dial, yung pinakita ko kanina, and the wet is controlled by a water level in a chamber. Kung mataas, then therefore mataas din ang pag-suck. Kapag maliit lang, then maliit lang din ang pag-suck niya, okay? Then the wet, and ang ginagamit na natin ngayon guys is the wet, okay? The wet chest tube system, okay? This includes a three chambers, guys. We have the collection chamber, water seal chamber, and suction control chamber. Okay? Si CCT, guys, the procedure itself, guys, hindi naman tayo ang gumagawa niyan. Doktor ang gumagawa niyan. Pero ang kailangan nating gawin, guys, is to monitor yung tatlong chamber na yan. Okay? The collection chamber, water seal chamber, and the suction control chamber. So, this is the chest tube system, guys. Okay? Wet chest tube system ang gamit nila dito, guys, dahil water ang nandito sa suction control chamber mo. Okay? This is the suction control chamber. Then, we have the collection chamber and the water seal chamber. Okay? So, ano yung sabi ko kanina? Kailangan continuously monitored mo yung tatlong chamber na yan. Tama? First, we have the collection chamber, okay? So, itong collection chamber, guys, ang ginagawa nito, siya ang nagko-collects ng air, blood, or fluid. As you can see in the visualization, di ba? May blood na na-collect dito kay collection chamber dahil siya ang nagko-collect ng air, blood, and fluid. Now, ano ang kailangan na gawin mo or i-monitor mo kay collection chamber, okay? Kailangan, guys, i-monitor mo yung amount, color, and consistency of the drainage. Okay? Kailangan sa color, guys, kailangan zero sanguinis ang color. Okay? Kapag bright red na ang nakita mo dyan, guys, it indicates active bleeding. Okay? So you need to report it to the physician. And the consistency, guys, kailangan thick. Okay? And the amount, guys, kailangan hindi lalampas ng 100 ml per hour. Okay? Kasi kapag nangyari yun, guys, you need to report it to the physician. Okay? Yun kay collection chamber. Now, let's discuss si water seal chamber naman. This one. Okay? This one. Meron ding water dyan, guys. Okay? Anong ginagawa ng water dyan? It prevents the air from entering the pleural space. Okay? Pinaprevent niya yung air na mag-enter again sa pleural space. Okay? So, ano yung kailangan i-monitor mo dito sa chamber na to, guys? You need to monitor the bubbling. Okay? Ano ang normal? Okay, ano ang normal na bubbling dapat, guys? Kailangan intermittent bubbling ang nakikita mo. Okay, when we say intermittent, guys, merong bubbling then nawawala, then nagmemeron then nawawala. That's the intermittent bubbling na tinatawag and it indicates normal findings. Okay? Ano yung abnormals? Kapag merong continuous bubbling na nangyayari dito kay water seal chambers because it indicates air leak. Okay, so ano yung kailangan mo gawin? Kailangan hanapin mo kung nasan yung leak. Okay? Then, lastly, guys, is the suction control chamber o this one naman, guys. Okay? It applies controlled suction or sa kay wet suction. Yun yung sabi ko, kung ilan yung water na nakalagay dyan, yun lang din yung isasak niya. Okay? Kung konti, then konti ang suction. Kapag mataas, mataas din ang suction. Okay? So, ano yung kailangan mong i-monitor, guys? You need also to monitor the bubbling na nangyayari dito. Okay? Kasi ano dapat ang normal? Kailangan gentle bubbling ang nakikita mo dito. It indicates normal finding. Okay? Ano yung abnormal? Ano yung abnormal, sir? Kapag wala kang nakikitang bubbling. Okay? Meaning, guys, hindi enough yung suction na nagagawa niya. Okay? Then, our intervention sa CCT, guys, or your chest tube thoracotomy, guys, we need to confirm the correct tube placement. Okay? Ano yung gold standard in confirming that one, guys? Si chest x-ray. So, after ma-insert yung CCT, guys, chine-chest x-ray natin yung patient to confirm the correct tube placement. Okay? What else? You maintain an occlusive dressing over the chest tube site. Okay? To prevent air from entering the chest cavity. So, kailangan dito, guys, merong occlusive dressing, okay, para ma-prevent mo yung air na mag-enter doon sa chest cavity. Okay, what else? You keep connections tight and tape to prevent leaks or disconnections, okay? Then you keep drainage system below the chest level at all times, okay, to prevent backflow of air or fluid into the pleural space. O bakit, guys, below the chest level? Because of the gravity of the earth. Kasi nga, etong chest tube system na to, guys, nagde-drain nga siya ng air, fluid, and blood, di ba? So kapag mas mataas siya dun sa patient, guys, then therefore possible magkaroon ng backflowing papunta or pabalik kay patient. Nagigets? Then, sa collection chamber naman, guys, you need to monitor, yung sinabi natin kanina kay collection chamber, you need to monitor the drainage amount. Dito, guys, okay? Dito, you need to monitor the amount, the color, and the consistency. Kailangan yung amount, kailangan hindi greater than 100 ml, okay? Then, the color, ang normal is 0 sanguinis, okay? Then, the consistency is kailangan thick, okay? Then, what if greater than 100 ml? You need to report it to the physician. Okay? Because it indicates hemorrhage, guys. Okay? Then you maintain proper drainage by ensuring tubing is free from kinks or occlusions. When we say kinks, guys, natupi yung tube. Okay? Nagigets? Then next chamber, guys, we have the water seal chamber. Tama, na-discuss na natin kanina. Si water seal chamber, guys, or this one, kailangan we ensure, guys, na it is remain filled with sterile saline. Okay? Ito, kailangan merong sterile saline at all times. Okay? Para ma-prevent yung backflow of air. Okay? So, you monitor for leaks by observing for bubbling in the water seal chamber. Okay? Ano yung normal kanina sinabi natin? Kailangan intermittent bubbling ang nakikita mo dito kay water seal chamber, guys. Okay? As air is drained from pleural space. Okay? And it will stop, guys, when pneumothorax is resolved na. Okay? So, kapag nag-stop na, guys, then therefore, na-resolve na yung pneumothorax dito kay water seal chamber. Okay? What's the abnormal finding na sinabi natin kanina? The continuous bubbling na makikita mo dito kay water seal chamber because it indicates air leak. Okay? Then, dito kay water seal chamber, guys, you need also to assess tidalling. When we say tidalling, guys, that is the fluctuation in the water seal chamber with inhalation and exhalation. O during inhalation, guys, dapat nagpapataas yang water na yan. Okay? Papataas yan, nagpa-fluctuate siya pataas. During exhalation naman, nagpa-fluctuate siya pababa. That's the tidalling na tinatawag. Okay? Then, if tidalling stops, okay, kailangan may tidalling na nangyayari, guys, ha? During inhalation, tumataas yung water, okay? Then, during exhalation, bumababa yung water. That's the tidalling, okay? It indicates, guys, proper functioning, okay? If tidalling stops, okay, so you need to check for kinks or assess breath sounds to determine if lung is re-inflated. O, sabi niya, pag nag-stop daw, guys, you check for kinks or kung nag-re-inflate na daw yung lungs or na-resolve na yung lungs. Okay? Paano mo ngayon malalaman kung kinks ba siya or re-inflation na ng lungs ang nangyari? Kung resolve or complication. Okay? Ganito yung atake dyan, guys. Okay? Sabi niya sa'yo, after 2 hours, nung ma-insert ang CCT, 2 hours, guys, you need to keep in mind this. After 2 hours ng insertion ng CCT, guys, nag-stop yung tidalling dito sa water seal chamber. So, ano kaya ang indication niya? Kinks ba or re-inflation? What do you think? Okay, kapag 2 hours pa lang, guys, meaning kinks ang nangyayari. Kasi kakakabit pa lang sa kanya, guys, eh. Pero, kapag 3 to 5 days na yung nasa situation mo, guys, then therefore possible, guys, na nag-re-inflate na yung lungs ni patient natin. So, meaning na resolve na, guys. Okay? Yun yung difference nun, guys. Okay? So, you need to be careful with that one. Okay? Now, let's move on to the suction control chamber naman. This one. Okay? This one. Okay? In a wet system, water in the chamber controls the suction. Yun nga yung sabi ko kanina, guys. Kung mataas ang water na nailagay dito, malakas din ang pag-suction. Kapag konti lang, mahina ang pag-suction. Okay? You need to maintain prescribed water level to regulate the suction. Okay? So, ano yung mga actions to avoid naman natin sa CCT, guys? Okay? Do not clamp the chest tube unless ordered. Okay? Because clamping may cause tension pneumothorax. Okay? What else? Do not strip or milk the tubing unless ordered. Okay? Because it creates excessive pressure and can damage the lung tissue. Then lastly, do not empty the collection chamber. Okay? You need to replace it when it becomes full. Okay, now, let's move on doon sa complication naman natin ng chest tube thoracotomy. Okay, so what if nag-complicate siya sa ganito? Ano ang gagawin nating intervention? Okay? For clients with a chest tube, keep sterile gauze and a bottle sterile water at the bedside to quickly address complications. So, kailangan kapag naka-chest tube yung patient natin, guys, merong sterile gas and sterile water doon sa bedside niya. Okay? So, first complication, what if yung tube is na-dislodge? Pag sinabing dislodge, guys, or the tube is dislodged, guys, meaning, guys, yung tube na-disconnect doon kay patient. This one, guys, na-disconnect or natanggal kay patient. So, ano ang gagawin mo pag nangyari yun or natanggal yun kay patient? You need to cover the insertion site with sterile gauze dressing. Okay? Then, you tape on 3 sides. Okay? So, di ba? Itong tube na to, for example, itong tube na to, natanggal na. Okay? Ano gagawin mo? You cover it with a occlusive sterile dressing. Okay? Then, ang i-tape mo lang, guys, is 3 sides. This one, and this one. Kailangan 3 sides lang. Dito na part, wag mo nang i-tape. Okay? Then, you notify the healthcare provider immediately after putting a sterile gauze dressing. Okay? What if naman the tube disconnects or the drainage system breaks, meaning yung tube naman, yung na-disconnect or na-break yung drainage system. Okay, anong gagawin mo? Yung tube, guys, yung tip ng tube, okay, ilagay mo into a sterile water or sa bottle sterile water, okay, to create temporary water seal. Kasi ganun lang din naman yung function ng water seal chamber mo, guys. Okay, so kapag na-disconnect yung tube, yung tip niya, ilagay mo sa sterile water to create a temporary water seal. Okay? What if naman air leak ang nangyayari as evidenced by a continuous bubbling in water seal chamber? Okay, anong gagawin mo? Of course, you check the connections. Then, you reinforce dressing. Then, lastly, you notify the healthcare provider. Then lastly guys, paano naman kung occlusion or there is no drainage dito sa collection chamber na nagpapakita? Okay, so anong gagawin mo? Oh, you need to check for kinks. You need to check the tubing for kinks. Then gently strip or milk tubing only if ordered. Okay? And that is all guys for the part 2 or for the diagnostic procedures of your respiratory system. I hope you learned something. Thank you and God bless.